minute before the hour, and I would like then to introduce our keynote speaker. Kathy McGuinn is the Director of Interprofessional Education and Practice Partnerships and Special Advisor on Quality Initiatives at the American Association of Colleges of Nursing. And at AACN, Ms. McGuinn has been involved in facilitating a variety of initiatives, including the creation and updating of AACN's foundational standards documents, most recently, the Essentials Core Competencies for Professional Nursing Education. That was published in 2021. In addition, Ms. McGuinn has served as a national quality expert for AACN, overseeing quality and safety education for nurses, faculty development grants from the Robert Wood Johnson Foundation and the Gordon and Betty Moore Foundation. From 2009 to 2012, she oversaw the curriculum development and the rollout of 9 regional undergraduate QSEN faculty development institutes. And from 2012 to 2014, she oversaw the curriculum development and rollout of 5 graduate regional QSEN faculty development institutes. Further, Ms. McGuinn has been active in AACN's strategic initiative related to interprofessional education, which includes assisting with the planning of the National Interprofessional Education Collaborative, known as IPEC, and actively participating with the Interprofessional Professionalism Collaborative, IPC. Most recently, Ms. McGuinn was the lead staff for the groundbreaking report, Advancing Healthcare Transformation, A New Era for Academic Nursing. So please join me in welcoming Kathy McGuinn, who will be giving us an understanding the new AACN Essentials next steps. Thank you, Kathy.
Thank you, Mary, for that kind introduction. I must say that I am so delighted to be with all of you this evening. I feel like I've come home. As many of you know, I have been a QSENista since the inception of the movement. I really have been very focused on preventable medical errors and quality and safety. I have been joined on this journey by such wonderful people. I'd like to give a shout out to the people who joined me from that 2009 to 2012 Robert Wood Johnson Foundation grant. And they were Jean Johnson, Jane Barnsteiner, and Joanne Dish. And also a shout out to the people that joined me on the graduate journey. And that was Jean Johnson, Karen Drinkard, and Esther Ahmad. It was just so wonderful to do that work. And I think it was the pinnacle of my career, especially with the Gordon and Betty Moore Foundation. They not only gave us money to do the institutes, but they gave us money to visit the schools. It was a 3-year grant. So it was just so heartening to visit the schools. And it was so powerful to see that the students could actually articulate the QSEN competencies and tell us how they were implementing them. So I'm just so blessed to have had this long and wonderful journey with QSEN, and I am delighted to be here with you this evening. So what I'm here to talk to you tonight is about the new Essentials document. And again, it was a 3-year process. We started in 2018, fully expecting to finish by 2020, but I bet you can guess what made it go a little longer, and that, of course, was the pandemic. So next slide, please. Okay, so that's my title slide, and I'll go to the next slide then. I want you to know that I have no conflict of interest here this evening. Next slide, please. And the objectives, here they are. We're going to describe the implications of the AACN Essentials for education and practice. And I'm so delighted that education and practice have been so aligned with getting these essentials done. We're going to talk about describing the new model for nursing education, including the transition to competency-based education. This is a big one. It's going to be a big change. And then we're going to consider strategies for academic practice partnerships to support the integration of these essentials into practice. And finally, I'm going to talk about the next steps for implementation of the essentials. So we have a lot of work to do, but it's going to be fun. Next slide, please. So now I'd like to introduce you to the Essentials Task Force leadership team. I think that I feel like I've been joined at the hip with these people for 3 years, but they are such highly dedicated and just inspirational people to work with. And it's been an honor and a pleasure to work with all of them. Our co-chairs were Dr. Jean Gidden, Dr. John McFadden, and Dr. Cynthia McCurran. Then we had consultants, and these were wonderful AACN champions, and they were in retirement, but of course you never get to retire. I guess maybe you get to be in preferment, but AACN does not let you retire. And so they came out of retirement, and everybody really worked hard on this committee. And then our wonderful Lynn Zahn, who was just an extraordinary board member liaison. And as you can see, the staff was Joan Stanley, myself, and Rick Garcia. Next slide, please. And again, this is the wonderful Essentials Task Force members. And it's very interesting. When this work started, we had 3 groups. We had an Essentials Task Force, a Baccalaureate Essentials Task Force, a Master's Essentials Task Force group, and a Doctorate of Nursing Practice Task Force group. But when we really got into the work, we realized that we didn't need 3 separate groups. We were going to create one document and have one group. So that was very dramatic change as we evolved. Next slide, please. Oh, before I get off this slide, I do want to mention, well, there's more there, but we had many practice representatives on the group. And so again, you know, academia and practice have been silos way back when I started, but I think in my lifetime, I am seeing such strengthening of academic practice partnerships, and I'm so happy I've lived to see it. So next slide, please. Yeah, and the next one after that. Okay, so this is just the background, and I'm sure the academics in the audience, these are near and dear to all of your heart because these are the basis for your accreditation experience. The Baccalaureate Essentials, which occurred in 2008. And again, I'd like to give a shout out to Dr. Patricia Martin, who led that work. The Essentials of Master's Education. And again, we were led by Dr. Joanne Warner, and that was wonderful. And then the Essentials of Doctoral Education for Advanced Nursing Practice. And that was Dr. Hathaway and Dr. Caroline Williams. So it's just been wonderful to work with these renowned people and do this wonderful work. Okay, next slide, please. Okay, so this is another point that I really want to emphasize. AACN really took seriously providing opportunities for feedback. We didn't have all the answers. We had to come to you. We had to come to everybody. And again, we always say, whatever document we start out with, it is never what we finish up with. It changed and evolved as this wonderful feedback came in. And there were many opportunities for feedback. We had 4 regional hearings. And of course, you probably remember the first one was in San Antonio, the second one was in Atlanta, and they were face-to-face. And then the pandemic came and we had to go virtually. And then we had 2 national faculty meetings. And I really think these were wonderful experiences for everyone. And all the feedback that came in from that, I do have to tell you, we just took all this feedback so seriously, analyzed it all, and many changes were made based on this feedback. There were many presentations to stakeholders where we got feedback, and then letters and commentary. People that were just so passionate about their work, they would write us a letter. And again, we seriously took what they had to say and wrote them very nice letters back. So next slide, please. Oh, this slide got a little messed up. But these are the, we listened and we learned. And these are some of the issues that came forward from listening and learning. And it was a call to action. As you can see, there were multiple degree paths in nursing education that are messy and confusing. Imagine that. Variability in program length, scope, and expectations, variability in quality of degree programs, an inability to articulate which is uniquely the discipline of nursing. Isn't that funny that as nurses, and we're in it for so long, that could be a problem? And then, of course, differentiating between technical and professional levels of nursing practice. Now, the essentials are not going to be a magic wand that's going to fix everything in one fell swoop. But again, at least we know what the issues are and we're working on them. Next slide, please. And then what we learned from our practice partners. Again, I do think there's been a lot of strengthening of the academic practice partnerships, but this is a wonderful quote from Jill Case-Worth, who's a senior vice president and CNO of Wellstar Health System. And what she had to say is, I never knew there were documents called the Essentials that could provide insight into the expectations we should have of a BSN graduate. We could build on that. Instead, we start at the lowest common denominator. So that was very illuminating to learn that, I mean, because as academics, sometimes we just take it for granted. Everybody knows our lingo, but they don't. Next slide, please. And then another wonderful quote from Susan Mullaney. She's the Senior Director for the Centers for Clinician Advancement with the United Health Group. And there is inconsistency among graduates across all degree levels in terms of knowledge, skills, and abilities. There is variability in length, expectations of programs. We are not sure what your product is. So that was eye-opening too. Next slide, please. Okay, so then as we listened and as we learned, it became very clear we weren't just doing a minor revision. We were going to have to re-envision the essentials. And what that meant is it was going to be a transformational document that would create the future for academic nursing. Next slide, please. So what did we do when we envisioned, made this transformational document? I think I've already mentioned the one big dramatic change, and that was we switched from thinking that we had to have 3 separate documents to 1 document. That's going to be a huge change for everybody. And then this idea of going to competency-based education. I mean, we had outcome statements in our other documents, of course, but we're talking about real competency-based education this time. And that means that no longer will we have our practice partners and our employers saying, we don't know what we're going to get when we hire a baccalaureate graduate. What we're going to have is we're going to have consistency for the learners, the outcomes for the learners, the outcomes for the employers, and the outcomes for the public. Everybody's going to know what they get when they get a baccalaureate grad because they're going to all have done the same competencies. Next slide, please. Okay, so here's our new model for nursing education, and I can just give you a little hint that this did go through a few iterations while we were working on it. So this is our final. And anyway, we have level 1. We tried to be simplistic and streamline our thinking, but at the same time include everything we needed to include. So the level 1 is entry level for professional nursing education. Sub-competencies is in that level. It's used by programs preparing a nurse for an initial professional nursing degree. Then we have level 2, and level 2 will include the advanced level nursing education sub-competencies. And on top of that, so this is just not only, sub-competencies, but then you could either have on top of that specialty competencies or role requirement competencies. And everybody knows, I think, what a specialty competency, I think of the informatic nurse, okay? They have another list of competencies to get certified. And then the role requirements, we have the advanced APRN groups, we have the nurse practitioners, we have the clinical nurse specialists, we have the nurse anesthetists, and we have the nurse midwives. And again, whatever the specialty or the role organizations require, they would do that in addition to the level 2 sub-competencies. So I hope I haven't confused you. I hope that's clear as day. But anyway, next slide, please. Okay, so here's the essentials framework. And again, there are 10 domains and there are competencies within each domain. And domains are broad, distinguishable areas of competence. And as you can see, each of those domains, it has a competence under each of them. To give you an idea of what the 87-page document includes, it includes a wonderful introduction. And I would give a shout out to Nancy DeBazio and all of our consultants, Linda Caldwell and all these people, but I probably missed somebody. So, but anyway, they just did a beautiful job on the introduction. So it's really worth a good read. Then we have the, domains, the domain descriptors, the contextual statements, then the competencies, then the entry-level sub-competencies, and then the advanced level sub-competencies. And finally, we have a wonderful glossary and reference list. So it's a very rigorous and academic document. Okay, next slide, please. Now, this is my favorite slide of all. To me, this is a work of art because to get consensus on what would be the 10 domains for the essentials document, you can only imagine everybody that had an area of expertise in nursing, anybody that had something they loved so much and knew it had to be a domain we heard from. But this was our best work and it was based on consensus and a lot of listening and learning. We can't make everybody happy, but we hope we made most people happy. And I hope the QSEN people are happy because look, all of your QSEN competencies are in there. Person-centered care is a QSEN competency. Scholarship has evidence-based practice in it. Then we have an even quality and safety domain, interprofessional domain, and the informatics. They all speak loudly to all of you, I'm sure. Okay, next slide, please. And then we have the concepts, because again, everything, we have the domains, but more importantly, there are concepts. And I want to make clear that the concepts are not lesser than the domains. Even though everybody wanted a domain, the concept list is just as important. What these concepts do is they're integrated across many different domains, and they're very important. But just to give you an example that they're not less important, if you're trying to practice person-centered care, can you imagine trying to do that without the competency of diversity, equity, and inclusion? You couldn't possibly do it. So these concepts are integral to our work. They're very important, and they're very well defined in the document. Next slide, please. Okay, so competencies are the ability of a health professional to integrate multiple components such as knowledge, skills, and values and attitudes into practice. So it's not just a one and done with competencies. They have to be assessed across many settings and increasingly complex settings. So it's a whole different ballgame. It's not that we get to the end of the program and you have a competency checklist and you say, okay, show me this competency. No, it's not like that at all. These competencies are going to be continually assessed throughout the program. Next slide, please. And this just further elucidates what I just said, demonstrated across all spheres of care and in multiple contexts. And the big thing is that we now are going to have clear expectations for the learners, the employers, and the public. And I think that is huge. Next slide, please. Okay, so here's your favorite domain, quality and safety. So you can see there's 3 competencies under that. Apply quality improvement principles in care delivery, contribute to a culture of patient safety, and contribute to a culture of provider and work environment safety. So I hope those resonate with all of you. Next slide, please. Then that was the competencies, but then underneath the competencies are the entry level sub-competencies and the advanced level sub-competencies. And this slide is to elucidate that it's not a one-in-one situation. So we have A, B, C, D, and E, and then, you know, it's not that because we have 5.3A, we're going to have a leveling up of that exact sub-competencies. The sub-competencies are relevant to the level, but not to each other, if that makes any sense. Okay, next slide, please. Okay, stakeholder feedback. Again, I'm emphasizing that a lot in this program. We spoke with our practice partners. AACN has a committee. It's the AACN AONL advisory group. They were part of the conversations all along, and many of our practice partners were. And our hope is that we will finally get to a point where we have the same language, that when we talk about the domains in academia, we'll be talking about those domains in practice. So for example, in practice, they could take the domains and use them maybe for orientation or for you know, clinical ladders and different things. So there's just so much work that can be done together. Regulation would be the fact that NCSBN was at our tables all the time. Accreditation, CCNE, our autonomous accrediting arm at AACN, was very much a part of the conversations. The employers, we again listened to them, especially organizations, and then those wonderful letters we got from our AACN members. Next slide, please. And then we had the vote, and what the vote, you know, we had the March spring meeting that AACN always has, and then because it was being done virtually, this was another challenge and all new to us, but we gave everyone 2 weeks to vote. And so it started in March, but on April 6th, the essentials were officially, you know, approved by our membership. And it has to be by a majority of our membership. and it was well above the majority, so I'm happy to report that to you. So the final documents, now that I've gotten you so excited about these documents, I'd like you to go to our website. We have the essentials document posted there. There's a wonderful roadmap document. It's only, whereas the essentials document is 87 pages, that's only 3 pages. So I think you'd love that. There's frequently asked questions, and there's a toolkit. And it's just a beginning toolkit, but I'll tell you more about that later. Next slide, please. Okay, now we're going to talk about transition and implementation and following the roadmap, that 3-page document I mentioned. Next slide, please. So here's where everybody can take a big, deep breath and a sigh of relief. It's going to take at least 3 years, probably, or longer for this to be rolled out in an acceptable fashion, because there is so much change, but it's good change. And so we're excited about it. Next slide, please. So what can schools now? I hope all of you early adopters are out there, can't wait to get started. And what you really need to do is to read the essentials document in its entirety. Then another good thing to do would be to crosswalk the essentials to your current curricula, participate in all the faculty development opportunities. You're going to be hearing so much about this from AACN. And again, engage with your practice partners to strategize and plan and implement the new essentials. But again, have that back and forth about how practice can use them, and you can use what practice is doing. It's just a wonderful time for strengthening academic practice partnerships. Next slide, please. So I can't tell you enough how AACN is throwing their full weight and support behind the implementation of these essentials. The first thing, again, is going to be appoint an advisory group. That has not been done yet, but it's in the process. They will have the broad overview and identify issues and recommend resources to support implementation. Again, there's going to be a lot of faculty development. You will see many advertisements for webinars and AACN conference presentations related to the essentials. And then we're going to continue stakeholder engagement. I think I've made that point quite a lot during this presentation. And the practice organizations, we again want them to be using these domains for orientation and for clinical matters and for many things that we haven't even thought of yet. CCNE, our autonomous crediting arm, I always hesitate to even mention or try to speak on behalf of CCNE, and I won't really do that now. I'll just state a few facts because they have very precise language and they know their business so well, and it's good to give them an opportunity to tell you what they're thinking. But at any rate, the last time they put standards in place was January of 2019. So the next time they will review their standards is in 2022, 2023. So just to give you an example, if they approve the AACN new essentials document, it probably would never go into place until January of 2024. So at this time, if you're up for review, you're still using those 3 essentials documents. And then CNC, that's on Commission on Nursing Certification at AACN, and they provide the certification for the clinical nurse leader. Next slide, please. Okay, one of the things I've mentioned a lot is we're transitioning to competency-based education. So one of the things we're suggesting, and again, I do a lot of the interprofessional healthcare work, so I can't emphasize enough, but if you have an opportunity to collaborate with your other colleagues who've implemented competency-based education, and medicine, PT, and veterinary medicine have done a terrific job with this. Develop a pilot program. We're thinking of doing that. We might identify early adopters or develop a call for schools to become a part of the pilot. These are all just ideas that are being considered. We haven't landed on anything specific yet. And then again, there will be webinars and conference sessions. Next slide, please. The Essentials Toolkit. As I mentioned, with those documents that are posted on our website, we have an initial toolkit. We do have a framework for it. It's going to have a lot about competency-based education resources and assessment resources and integrative learning strategies. When I was doing my work with QSEN, every audience, all they wanted to hear, okay, How do you do it? What are the specific learning strategies? And what are the teaching resources, recommended content, and recommended assessment strategies? So at this point, we have just some exemplars, and we've started out with exemplars for Domain 3, Population Health. And I'd like to give a shout out to Sue Swider and Casey Shillum and some other members of the Essentials Task Force. They began working on the toolkit for Essential 3, and then Essential 5, Quality and Safety. I'd like to give a shout out to Jerry Altmuller. She did an exceptional job in getting us started with the toolkit for quality and safety. So it's something to build on, but we will have more to say about that soon. Okay, next slide, please. Another thing that we're going to have to do is develop development of new digital documentation tools, right? You're now going to have to keep track of all these students attaining when they attain competencies. You're going to have to track how your curriculum has changed. So we will need new digital documentation tools. Next slide, please. Okay, and we're going to end with, I hope, 2 inspirational quotes. And these are from 2 practice board members at AACN. And I have the deepest admiration and respect for both of these people. So I hope they speak loudly and clearly to you. And the first is from Marge Wiggins, and she would say, I would say the domains, competencies, and sub-competencies developed in partnership with practice partners proves a strong basis for the practice of a new graduate. The clarity and consistency of undergraduate nursing education provides a foundation to build upon as they transition to practice. As well, this will facilitate a more stable population of new nurses more likely to adapt and stay in nursing in today's highly complex healthcare systems. So as a CNO, and I was in practice for many years too, you're always thinking about retention. So she thinks this is going to help retention, I'm sure. Next slide, please. And this is from Dr. Jerry Mansfield, and he's Chief Nursing Officer of Mount Carmel Health System. And he's talking about meeting the needs of the profession. Develop and sustain an enduring mutual respect for our education practice partnerships, making a commitment to finding one lens for the professional identity and competencies of nursing. So I think the message is academia and practice are going to get together and do a wonderful job in defining and transforming nursing for the future. So with that, I'd like to say thank you very much for your attention. I know you might have a few other things to do from 5 to 6, but at any rate, I'm open for questions. So I'd love to take any questions that you might have at this time.
Excellent. Well, thank you so much, Kathy, for that really informative presentation, kind of to give us the background, how these new essentials were developed, and then the future steps for the new essentials. I do have a couple questions to get us going, but I do want to encourage people out listening to chat questions, comments in the box. I'm sure that I am the same as many other faculty across the country who are anxious and anticipating change and a lot of work ahead of us. But I do want to reflect on the QSEN competencies, and that, we have about, 17 or 16 years with the QSEN competencies. That was also competency-based education with a wonderful, I guess, repository of strategies for how to implement those competencies into practice. But how do you see that the QSEN competencies were used to inform these new essentials? I guess, in other words, where is the alignment, and how much of what we've already done in the past 17 years on assisting with competency-based QSEN integration for the new essentials?
Well, the QSEN movement has been alive and well since 2005, when Linda Cronin started, and when they were published in 2007. So the QSEN competencies informed the work of the last 3 documents. I was on all of those task forces, and I can't say highly enough. I think it's just that, we had more outcome statements, and now we're really going, and we were not into the degree of competency assessment. But I think maybe, and then as we move to this new essentials document, I tried to point out that, Essential 2, Essentials 3, 4, the QSEN competencies are clearly evident in the new Essentials document. But what I would say is those that have done such a great job with the QSEN competencies, when they're doing the curriculum mapping and seeing what's up, they might be pleasantly surprised that they're already doing a lot of this. But if you don't have a strong background in QSEN, but there's still, I would say QSEN is a subset of the whole document because we have other, population health is emphasized and it wasn't emphasized in QSEN as much. Systems, professionalism, leadership. There's a lot of other things, but I think if you have a strong core of QSEN competencies in your curricula already, then you're going to be in good shape.
That might actually be a nice little article on how, to demonstrate some of the schools that have a strong QSEN framework that they're, using currently, and how that's accelerating their integration of the re-envisioned essentials. Okay, well, thank you for that answer to that question. I did see some questions in the chat, so I'm going to do my due diligence on that, and the chat moves fast. So first question, how do you envision or would you guide progression from AD to BSN or MSN to DNP using the essentials?
Okay, what was the first one? Thank you for that question. And it was AD to BSN?
Yeah, how do you envision that you would guide the progression from AD to BSN or like an MSN to a DNP using the essentials?
Well, it's just that we have now the new sub-competencies. We have new competencies and sub-competencies. So for anybody doing an entry level, and that would be an ADN to a BSN, they would, and they could do an assessment, and perhaps they have already mastered some of the competencies, and it's going to be easier for them to demonstrate competencies. But they are still going to have the same exact, go through the same things that people in other programs have gone through. And then the masters to the DMP, again, we now have advanced level sub-competencies, but on top of that, the advanced level sub-competencies were written with the DMP in mind, but it's up to the individual organization to decide after they attain the advanced level sub-competencies, whether they're granting a master's degree or a DMP degree. And so at that point, it would be up to the institution. But then on top of that, it's, the specialty organizations or the role organizations, they're on top of the advanced level sub-competencies.
Okay, and then the next question from Karen Goldschmidt was, has there been any clarity made in the many pathways for entry into nursing? How about the other pathways to graduate education? It's a really good question.
Yeah, that's a great question. I think, any pathway you choose I think what the thing is, you're now going to have consistency when you get to the sub-competency level. We know that there's many, many different pathways, and we try to consider all the pathways. We spent many times, and we at one time had on those diagrams all the different ways. But the main concept is to streamline it and to think, it's a very simple concept. If you're entry into professional nursing practice, you're going to use the level 1 sub-competencies. And if you're master's or DMP, you're going to use the level 2 sub-competencies in addition to the specialty competencies and the role competencies.
I did see on that topic, I did see somewhere in one of your slides, like technical and then professional. Could you clarify those terms?
Well, that's always been, those were just the main issues. When we listened and we learned, that was one of the problems that they said from before. You couldn't tell what the difference between a technical or a professional. I mean, we've all been in nursing long enough not to, talk about the elephant in the room, that we used to say that, the professional nurse had a baccalaureate or higher, and the technical nurse didn't have the baccalaureate degree. So, but AACN has many white papers and documents. We believe any education is great, right? And we just have to get people moving along on the education continuum. So if you're an ADN, there's papers that AACN written, and this is how you do it with a 2+2 program, or this is what you do. And there's ways to do that very easily these days. RN to BSN programs are flourishing. RN to, they could go RN to MSN. you need a lot of career counseling when you're doing these things, because people have gone off in many different directions.
Mhm. And another, Tammy wrote, I noticed that the nurse educator role is not listed as a graduate specialty. How do you envision the curriculum for the nurse educator role to meet the new AACN standards?
Okay, and this is another elephant in the room, so thank you for that question. It's good to get all the elephants out. But there's always a lot of concern. I have to say, in my prior life, before I came to AACN, I was on the senior management team at George Washington University Hospital, and I was director of quality and education. And so when I came over, it was a little bit not hard, but I had to understand what they were saying. And I'll just mention this, and then I'll try to answer the question more directly. But the thing that finally rang a bell with me was, okay, if I had a baccalaureate degree, and then I went to a master's program that was only teaching me about education, and that would be, adult theories of learning and how to do test construction and all the wonderful pedagogies and things that they teach in the education courses, which are very important for faculty to have. But if I only had a baccalaureate degree in nursing, and then I got all that education theory, I only was at the level of a baccalaureate nurse teaching a baccalaureate nurse. I had not advanced my science in nursing. So that's what finally rang the bell in me. So AACN is not saying anything derogatory or negative about all these wonderful courses. What they're saying is you have to have advanced scientific knowledge of your discipline before you can teach a level lower about what nursing is. We're first nurses first, and then the education degrees. When I got my master's degree at Catholic University, I had my clinical focus, or my advancing the science of nursing, was in medical surgical nursing, but then my functional role was in education. So Dr. Virginia Conley, I read all her books and all that. Nobody is saying that we shouldn't have these wonderful courses on education. We're just saying you have to advance the science of nursing.
Mm-hmm. Okay, that's good. I know, yeah, I work with a lot of physicians and in education, and they do a lot of focus on advancing the science of an education of, in medicine. I'm hoping that we can also embrace that as a profession, because
well, medicine is a practice doctorate.
Mm-hmm.
And just as, the DMP is a practice doctorate.
Mm-hmm.
And if then they decide to add on to that, but they have their advanced knowledge in medicine
Mm-hmm.
first.
Mm-hmm. Yes.
I know this is going to create a lot of confusion and conflict, but we've been fighting that battle for years. But I think AACN's position is good, because we have to be a science of nursing before we can be anything else.
Mm-hmm. And Tammy, I don't know if that answered your question. I hope it did. I still kind of have a couple questions in my head, but then Karen Baus also asked, what led to the decision to eliminate the differentiation between master's and doctoral level advanced level practice?
Well, we think that's an institutional, the degree granting is the institution. What we're just saying is those advanced subcompetencies were written with the DMP in mind. But if they want to choose to grant a master's degree with just the advanced, they can do that. Or if they want to give the DMP, they can do that. But in order to, go on in your education, you're going to have to also do the specialty or the role competencies too.
Mm-hmm. All right. And then Kathy Coleman asked, why is the AACN 2013 white paper for Master's Essentials and CNL Curricular Education not a source document? I saw in 2011 was listed, but not the 2013. I truly appreciate the inclusion of the CNL role and recommended practice experiences in the advanced level of practice.
Well, I don't know if your question is completely about the document, or if your question could be about the CNL and where this fits in. I can only say that we've been in close communication with CNC. We value the CNL very much, and we want to know where they think it fits in. And they've done a lot of work in mapping the CNL competencies to our documents. Mm-hmm. And they think more that the CNL falls on the side of the level 2 subcompetencies. So all that's being ironed out. I think if you really have a strong feeling about a source document, then it could be included in the references. Is that what I'm hearing? Just send that thought in, and we can see what we can do with it.
Okay, good, good. And then Eva asked, the nursing practice community is so varied. I would presume even more varied than nursing education. Are there next steps on the practice side? So what should the practice side do to prepare for these changes?
Well, first of all, they have to be aware of them, and we have to be talking the same talk, and it's only through collaboration. And I have to say that, we have really, AACN is now having CNOs to their annual spring and fall meetings, and again, this AACN, AONL. So I remember when I did the QSEN work, and I don't think we had as many practice partners as we should have at some of those QSEN institutes. So our students would graduate with this wonderful knowledge of QSEN, and they go into the practice environment and they weren't seeing the same talk. They had all this wonderful education, but they couldn't see it in the practice environment because those nurses had been out of school for 20 years and they hadn't heard of the QSEN competencies. But now I think there is a much better alignment between practice and education with this document. There's been so much more input. Again, like I said, if we can, and that's what the AACN, AONL, we've had some strategic meetings, and I think AONL is going to endorse these domains. And if they do, they have their own great competencies about leadership and all that, but that doesn't take away anything from them. But if we all just agree to the domains, and we're talking about one language, and they can start using that for orientation and clinical ladder development. And so when the students graduate, it won't be the end of hearing about these domains.
Yeah. So sounds like then the call is for more academic practice partnerships to sort of work collaboratively on the implementation of these competencies into practice.
You hit the nail on the head, Mary. I couldn't have said it any better. That's exactly what we should be doing.
Yeah. And interestingly, I think that we have seen in years past, there has been a huge gap with our graduates and their competence to deliver quality and safe care. And Joan Cavanaugh and Pat Sharpnick tomorrow are going to talk about that, how they have done these assessments and the decline in the, I guess, readiness for students when they graduate to practice quality, high quality and safe care is really on the decline, and almost quite a crisis, right now. So maybe we will move forward in a more positive way to ensure that our new grads are ready to practice and deliver high quality, safe care. All right, one more question. How do you envision RN BSN students would actually assess their already achieved competencies? Would it be a mix of assignment and self-assessment? That's a great question. How do we really, I guess, work to build on the RN when they're in these BSN programs instead of kind of replicating curriculum, but to advance them to new arenas to be leaders?
Yeah. I would just say that I think the work that's been so great on this concept is not Dr. Nelda Godfrey's work from Kansas. And she actually took the 103 baccalaureate essentials outcome statements or whatever, and she made 4 quadrants, and the lower 2 quadrants would be outcomes that the ADN nurse already had, and then the upper 2 quadrants would be those that would be gained by getting the baccalaureate degree. So I would recommend, if anybody's looking for a 2+2 idea or something like that, they've done wonderful research, evidence-based work on this very thing.
Yeah, I had a friend who did an RN to BSN, and I was just very saddened by the curriculum that she went through. And I was thinking, what a great potential to have these RNs become leaders in quality and safety, really systems thinkers, and maybe in that systems-based practice competency to really take off on that competency. So thank you, Elisa, for that question. Cindy asked, the refresh of the essentials is timely with the changes occurring in healthcare, and timely with the NAS IOM, the future of nursing. Are there 2 to 3 pearls or nuggets that you would identify as priority for us to focus on embracing the new changes, updates?
Well, I think some of the newest things that we really have to think about are some of the concepts, the social determinants of health, or the determinants of health, whatever you want to call them. I mean, if you've gotten into that work at all, you realize that only 20% of clinical care accounts for health outcomes, and the rest is really the determinants of health. So as the CDC says, it's not your healthcare outcomes are largely determined by your zip code. So it's your education, it's your finance, it's your, are you, have food, or just the essentials that we take for granted. Some of us, that's so important. How can you help your patient if they can't even get a ride to see the doctor or whatever they need to do next? So I think as nurses, we really have to really dig deep into the determinants of health. And I don't know if we've done that in the past to the point that we're going to need. I think we've been very acute care focused. I think nursing with this pandemic, we saw how telehealth worked, how working in the community, giving vaccination works, how, we just have so many different settings that we can do. So I would say the determinants of health, and of course, diversity, equity, inclusion, again, with what we've been through with the pandemic and with the problem with structural racism and things in this country, that can no longer be on the back burner. That has to be front and center. And again, population health is domain 3. That's new and different. Well, not new and different. I'm sure I don't want to offend any of the population health people, but it hasn't been as upfront and well-defined as it's been. There's just so many wonderful things about the new essentials that I just gave 3 that I thought were new and different.
Yeah, no, I think I would agree. And, it reminds me of with QSEN, how they were new concepts for faculty, and there needed to be a lot of faculty development. Are you foreseeing that there'll be faculty development in these topics?
Oh, absolutely. Like I said, I think AACN is going to throw its full weight behind doing anything it can to help with the implementation and then transition to this wonderful new document. And it's going to improve. Let's not forget the patient. What are we all about? We're about patients, and this is going to ensure that everybody is competent to take care of patients, and it's going to improve the health of our nation.
Yes, yes. And then Lisa wrote, I am curious how an MSN leadership degree furthers the science of nursing and MSN education does not. Please clarify so I might communicate to my colleagues.
Well, I think the leadership degree has the same issue. It has to have advanced nursing practice in it also.
And then Tracy Holt wrote, if the MS in nursing education program has advanced assessment, advanced patho, and an adult health practicum, where does this type of program align? Advanced level or not?
That would be good. That would be required. All advanced level 2 nursing requires the 3 Ps, and that's, everything we know near and dear to our heart. Pathophysiology, pharmacology, and physical assessment. I taught physical assessment for 6 years at Marymount University. It's near and dear to my heart, but that is an integral part of our science in nursing, and everybody needs to know it. When they're implementing it, it's different. If you're a practitioner, you're implementing that very differently than if you're a leader. If you're a leader, you need to know that when you're managing a pandemic or managing, all these problems with antibiotics or whatever. You just have to be aware, because you're going to sit on all these different settings where you need to have a knowledge that is commensurate with all your other healthcare professionals.
Someone also wanted to hear the name of that author of the 2x2, the 2+2.
Dr. Nelda Godfrey, Nelda Nelda, Godfrey Godfrey from Kansas. She's wonderful. She's very supportive. Don't you work closely with her, Mary, or not?
No, we haven't with QSEN.
Oh, okay. Okay. Well, she's worked closely with us on so many different things. And she's written a lot about professionalism too. She's really a wonderful nurse leader.
Yes. So I would sort of assume that the QSEN teaching strategies that we already have, published, I think there's about 260 published to date, might be useful then for the implementation, of the new, re-envisioned essentials into education. So that might be a resource for people also who are on
I still go to those all the time.
Yeah, the implementation is always the hard part, right? And
right.
And so I appreciate that you had mentioned it might take 3 years, and I think you're probably on the right target. And I
Yeah.
think, you know, now with implementation science, we do have some insight in evidence-based strategies to get things implemented into practice. So hopefully the AACN is also using those. Probably a
Yes.
big gap is the assessment. I mean, we struggled with that with QSEN, you know, really trying to develop assessment strategies for competency assessment. Is there, do you have a special
Yeah.
task force on that, or?
That's going to be, that was one of the components of the toolkit. And there will be a toolkit committee, toolkit work group that will be developed. First, it's going to be that advisory group, but a subgroup of that will be the toolkit work group. And that will be comprised of subject matter experts on both the essentials and the concepts. And so assessment is part of the toolkit. And we need assessment tools.
Mm-hmm. And I'm thinking that probably grant funding is going to be needed to develop some of those. I'm hoping that we can maybe forge some partnerships on obtaining grant funding to kind of you know, get this going,
Yeah,
going.
I think it's an ideal environment for grant. I mean, I just can't believe how my career was so, I benefited so much from those Robert Wood Johnson Foundation grants. I mean, our profession, you know, just learned so much from those.
You're right. Yeah, and I'm thinking that probably with this academic practice partnership and demonstration that education, you know, leads to better clinical outcomes. So that if we could measure the competence and then measure the clinical outcomes, boy, we would really have some secret sauce there to demonstrate the value of nursing. So
Right.
I see that as a vision for the future.
I think
So
so.
yeah, so there are no other questions in the chat box, and we're at the
Okay.
10 till hour, but I do want to just heartfully thank you, Kathy, for coming on this call today, you know, to help us to kind of get us started on thinking about our next steps. And I think the mapping of the essentials is a good next step. And then probably, as we learned with QSEN, that a powerful strategy was just sprinkling in some of the competencies into the current curriculum, you know, was an easy start. Also, I loved your message of the academic practice partnerships, because that is the theme of our conference this year. So to everybody on this call, come tomorrow because we have some great exemplars of those.
Yeah. I'm just so happy in my lifetime that we're not in silos anymore. I really feel us coming together, and I'm just so thrilled to see it.
Yeah, I am too. Because, you know, we are at the front line, and quality and safety occurs at the point of service. It's every nurse making that difference for every patient. And so I think that is a key piece. So, and I just would like to thank all of our participants for coming on today. We will put this recording on our QSEN website. I hope that you do register for the conference and maybe cook up that coconut chickpea bowl for your meal. I did put the evaluation link in the chat. So if you can click on that evaluation and then complete the survey, and then there'll be a download for the certificate. So you'll receive one, I think they call them continuing nursing professional development credits. Well,
I wish you the best in your conference. I'm sure it's going to be terrific. So
yes, and thank you for
it's a wonderful program.
Thank you, Kathy. And thank you for the enduring support of AACN throughout all these years. We've had a lovely run with Robert Wood Johnson Foundation.
Yes, we certainly have.
Yes. And so is there a next slide, or are we?
No, we're done.
Okay, great. Yes.
Oh, your next slides. Yeah.
All right. Well, thank you again, everyone. Have a very lovely night. To quality and safety and beyond.
Thank you. Good night.
Good night.